Okay, go ahead.
So when Tracy and I first started discussing our thoughts on HIPAA, one of the first things we did discuss was how much we've both noticed we see HIPAA spelled incorrectly. Do you ever wonder how to spell? Do you have trouble ever trying to spell this acronym? Are there two P's in HIPAA, like in the word hippopotamus? Or is there just one P in the word HIPAA, in the acronym HIPAA, like in the word hip? Well, we have a suggestion. If you think about that we're talking about healthcare and about seeing providers and our bodies, think about the word hip and how it has one hip, how it has one P, and then you'll be able to spell HIPAA properly, which is HIPAA. And then HIPAA does stand for the Health Insurance Portability and Accountability Act. So going on to a little bit about the history of HIPAA. It was first signed into law by President Clinton in 1996. And then there were two additional laws that have been added since then. One was in 2009, and this was called the HITECH Act. And what this did was increase the penalties for those that were non-compliant with the HIPAA laws and that had data breaches. And then just a few years ago in 2013, the HIPAA laws were strengthened even more and called the omnibus rule.
All right, so there are actually 5 titles to HIPAA. This presentation will focus on Title I and Title II as they are the 2 main parts of HIPAA. Title I is called Health Insurance Reform, and Title II is Administrative Simplification. All right, so Title I deals with portability and COBRA. All right, so Title I of HIPAA deals with healthcare portability, access, and renewability. Portability, the P in HIPAA, means that an employee and their family that were part of an employer-sponsored insurance plan is entitled to retain certain benefits when they have changed or lost their job. Through Title I, group plans cannot deny coverage or adjust your premium due to your health history. Also, rules have been established on how group plans deal with pre-existing conditions and the length of time they could exclude your conditions. Before HIPAA, those with pre-existing conditions could be completely denied. Now COBRA stands for Consolidated Omnibus Budget Reconciliation Act. According to federal law, under COBRA regulations, employers are required to give departing employees the option for continued health coverage at the employee's own expense. Your employer is required to give you COBRA benefits paperwork before you or when you leave your job. Now, who qualifies for COBRA? And that's individuals who were previously covered under a group health plan and have lost coverage due to either termination of employment, divorce from the covered employee, or a COBRA participant's newborn or adopted child. When do COBRA benefits end? Qualified beneficiaries can receive COBRA benefits for up to 18 continuous months. It's up to the beneficiary to give notice if enrolled in another group plan or if Medicare is received. The right to receive COBRA benefits terminates when the beneficiary is covered through other insurance.
And so Title II, which is the privacy law. So the privacy rule of HIPAA, it governs how private information is used and how it's also disclosed to other people, and whether that information is electronic form or verbal information or in written form. And so now, because of the HIPAA laws, individuals now have much greater access to their healthcare information as far as more rights, and as well as more rights to this private information. So what is PHI? We often hear that acronym. So PHI stands for Protected Health Information. And it really is just any information, including any kind of demographics. It could be, of course, patient's name, date of birth, phone number, address, social security number, any information that's created by a healthcare provider, an insurance company, or an employer. PHI can be information from the past, the present, or the future. It can also be on the physical or the mental health of a patient. It also covers any kind of billing information, whether it's past, present, or future billing, or any kind of payments for healthcare. Basically, PHI is information that identifies an individual or information that might possibly, when put together, identify an individual. So who must follow this law? So most doctors, nurses, hospitals, clinics, pharmacies, nursing homes, many other healthcare providers must follow this law. Also, health insurance companies, HMOs, and most employer group health plans. And finally, government programs that pay for healthcare, such as Medicare and Medicaid, must also follow this HIPAA law. And what information is protected? So it's information that any kind of healthcare providers put into a medical record for an individual. It's verbal conversations that a healthcare provider has about a patient's care or treatment with others. It's information about an individual that might be in an insurance company's computer system. Again, it's also the billing information that any kind of clinic or facility or agency has in their systems. And it's all medical records and identifiable health information, whether communicated electronically, verbally, or on paper.
All right, so we thought it would be kind of interesting just to put a few scenarios out there. We're not going to give you the answers to these scenarios. Just think about it and decide if you think it's HIPAA compliant. If you have a question, maybe look it up and see if you feel like that would be breaking HIPAA, if it would be a HIPAA violation or if it falls under compliant. So a sign-in sheet at a reception's desk, the patient's name called out loud by a medical assistant or nurse, being in a public elevator discussing a patient with his or her name not being used, using email about patients between doctors or staff. Now, understanding HIPAA, for me, I feel like if I understand what something is not, it helps me understand what exactly something is. So here are kind of some do and don'ts of HIPAA. Number one, HIPAA does help lower your change of existing coverage. It does erase your ability, or ease your ability to switch health plans. And it does help you buy coverage on your own if you lose your employer's plan. Now, what HIPAA does not do, it does not require employees to offer health coverage to employees and their family. Doesn't control amount for health insurance coverage costs. Doesn't require group health plans to offer certain coverage, and it doesn't eliminate pre-existing condition exclusions. Now, for takeaway tonight, one of the most common reasons for HIPAA violations is an employee who is not familiar with HIPAA regulations. Often only managers, administration, and medical staff receive training, although HIPAA law requires all employee, volunteers, interns, and anyone with access to patient information to be trained. Compliance training is one of the most proactive and easiest ways to avoid a violation for your office or facility. And these are just some acronyms you can look over. They're common HIPAA acronyms. And those are the sources that we used.
Awesome. You covered the topic really well. I love the way to remember how to spell HIPAA, because I've seen that spelled HIPPA more times than I've seen it spelled the correct way. So that's awesome. These presentations, so that's great. Let's see here. I'm gonna stop again.